Beam technology at OSF HealthCare helps guide neurosurgeons in a futuristic procedure. Now here we've got Dr. Andre Maldonado. He's an epilepsy specialist neurosurgeon at OSF Illinois Neurological Institute. Good morning.
Good
How are
morning.
you doing today?
Good morning. Thanks for having me here. I'm very good. Happy to be here.
Well, first off, what does NeuroBlate epilepsy surgery do, and how does it work?
NeuroBlate is a special, minimally invasive procedure that we use to treat seizures. For patients who have been suffering with epilepsy, we can use laser technology to treat those areas of the brain that are causing uncontrollable seizures.
How does that work? How does the laser technology assist with that?
So, laser basically, essentially what it does is heats up the tissue in the brain, the abnormal tissue that is causing the seizures, and it burns it to the point that becomes dysfunctional.
Oh.
And with that, in that way, you can basically abolish the seizures.
Oh, and so it allows you to get into areas maybe you couldn't hit with a scalpel kind of thing?
Exactly. As opposed to open brain surgery, this really utilizes a very small, tiny hole in the skull through a very tiny passage into the brain to the target areas that need to be treated without needing to make incisions or remove parts of the skull.
I see. And so what are some of the big wins for patients who opt for this kind of care, laser ablation, compared to other types of surgery?
Of course. So with traditional open epilepsy surgery, one of the things that we see obviously is an increase in the operative time in addition to the stay after the surgery. You know, it goes from 3 to 4 days after the surgery, you need to stay in the hospital. With a laser ablation therapy, since it is a minimally invasive procedure, patients stay only about 24 hours after the surgery and they can go back home after the procedure.
I see. And so how does the laser get in there if you're not making incisions or opening up the head?
So, yes, we do make a very tiny incision. For that, we place the patient
minimally invasive.
Exactly. So we place the patient under general anesthesia. Patients don't feel absolutely anything. We make a very tiny incision on the head, drill a little tiny hole through the skull, and then we pass this very tiny, it's like a fiber optic cable, goes towards the target using robotic technology.
That is amazing. I am stunned constantly at the achievements that medical science is making. And so what should people know if they're listening and wondering, is this right for me or a loved one? What makes a person a good candidate for this procedure?
That's a great question. So patients who are candidates for epilepsy surgery are those patients who have intractable epilepsy, especially those patients in whom we have discovered a very small, perhaps a very defined area of the seizure focus. Those are the patients who would benefit the most from this type of procedure.
I see. So it's really sort of like a specific, more acute kind of epilepsy that you'll want to treat with something like this.
It does depend on the type of network that the epilepsy involves. However, most of the time we are able to find very small areas that can be treated with either open surgery or laser surgery. However, we would prefer to always do minimally invasive procedures as opposed to open with similar outcomes.
I see. And how do all these specialists work together to give patients that precise care that they're looking for?
At OSF, we have a very nice group of neurologists, epileptologists, neuroradiologists, psychologists, and the neurosurgeon who, we meet together in the room, we discuss details about every single patient's clinical situation, and we talk about all the options that they have. They have many options, not just the laser surgery, but also open surgery and other types of neuromodulation that can potentially improve their seizure frequency and severity, and in some patients, we can actually find a cure.
All right. And how does it feel to be part of this transformation of care? What does the future look like?
So the future goes towards the path of minimally invasive brain surgery. We're seeing that many studies are coming up, and we are seeing more and more intervention with minimally invasive surgery as opposed to open surgery.
That's really amazing. Of course, we will have this full interview on our website shortly. Dr. Maldonado, thank you so much for coming on the show.
Thank you.
And of course, if you want to stick around, well, do so, because we have another half hour of 25 News Good Morning in just a few minutes.